My name is Doug Strane. I'm an epidemiologist and children's health policy researcher here at PolicyLab. And today I'm going to be talking about the 2020 census and why it matters for children's health. People should be concerned about the 2020 census because of some of the challenges that the Census Bureau is running into in the preparation for the 2020 count. So for the first time in 2020, people are going to be able to go online to respond to the census forms, which is a huge step forward into the 21st century. But that comes with a huge price tag, and so it's estimated that the Census Bureau has a funding shortfall for the 2020 census life cycle of more than $3 billion. And part of the price of that funding shortfall has been that 2 out of 3 large-scale, really important tests of new census counting methodology were canceled in 2018. And these tests were supposed to take place in rural and suburban settings. So that means when the census goes live in 2020, some of these new counting methods will not have been tested in different types of communities around the US. And in addition to this, for the first time since the 1950s, the Census Bureau has proposed adding a citizenship question to census forms. And there's a lot of people that believe that this could dissuade immigrants or people living with immigrants from responding to the census, which could result in an undercount of those communities. People should be concerned about these problems because we know that in past censuses, minorities, low-income communities, renters, and people in rural communities are more likely than the general population to be missed by the census. And children, especially young children, are included in this as well. So in 2010, as much as 4.6 or nearly 1 million young children ages 0 to 4 were missed by the census. And with canceled tests of new census counting methodology, it's difficult to say how these are going to affect the differential undercount. Undercounting matters for public health because the 2020 census is going to be used for the next decade in a number of ways that are going to affect children's health. And perhaps the most important is that the census is used to determine the level of federal funding that states receive for a number of programs that affect children's health. So Medicaid, WIC, Section 8 housing choice vouchers, the Low-Income Home Energy Assistance Program, CHIP, foster care, a number of these programs that either affect direct healthcare access or serve as important countermeasures against social determinants of health. The funding levels are determined based on the results of the census. The census matters for public health because having good data is really the cornerstone of good decision-making in public health. And the census is really the best way that we have of understanding the populations that we serve. So if we don't have an accurate population count in the census, or if certain populations are represented less accurately than others, it makes it really challenging for public health agencies and children's advocates to understand the communities they serve and to understand the disease trends that might be happening in those communities. So at its heart, the issues that are currently happening right now with the census are health equity issues, because we know that if not everyone is equally likely to be represented in the census, then the effects of undercounting could hit some populations harder than others. So if we care about health equity, then we need to care about getting an accurate count in 2020. And if you're interested in learning more, you can check out my piece in the American Journal of Public Health.